Hello, I'm Jean Pete, and I welcome you back to our show, Better Living. Better Living is brought to you by the Homestead Hope Foundation and is sponsored by Homestead Hospice, where commitment to education and premier hospice care helps patients and families through life's most important journey. Thank you for joining us again this week. Today we have another great show in store. We're going to talk with Dr. James Short and give you tips on staying healthy this cold and flu season. We're going to talk about urgent care centers and how they're not all the same. We've done a similar show on that before, but today we're going to talk a lot about different conditions that people may have and how to keep you out of the urgent care centers and clinics. But if you have to go there, some good tips on how to choose which urgent care to go to and how to treat yourself to make sure you don't have a repeat visit. So Dr. Short, thank you for coming and being on the show this morning.
Thank you.
Why don't we tell a little bit about your background? Who are you and how did you come to be?
My name is Dr. James Short. I've been in Atlanta since 1981. I'm board certified in family practice. I've been doing urgent care for approximately 2 decades and currently am the site director at Well Street Urgent Care on Ponce in Virginia Highlands.
Right here downtown Atlanta.
Yes.
For you folks not listening from Atlanta, this is important information. As we know, this time of year, people get colds and flu all over the country. Because Dr. Short, we also air in Phoenix and the Gulf Coast and New Orleans. So don't turn that dial because it's important information no matter where you live. Unless you have something new to tell me that there's somewhere in the country where people don't actually get sick.
No, I wish.
Okay. So you're 2 decades here in Atlanta. Where are you from?
I went to school at LSU. Then came to Emory and then University of Florida, then moved back to Atlanta.
Are you from New Orleans?
From Louisiana.
Louisiana? I'm sorry. Yeah, that's right.
North Louisiana.
Louisiana. So Dr. Short, talk to us a little bit about Well Street Clinic and how you all are a little bit different, what people need to know when they are faced with an acute symptom that may make them go to either the emergency room or the urgent care clinic. Let's get people aware of what Well Street's all about.
Well, urgent care in general is a step down from the emergency room. It's to provide you a service when you have an acute need. You can't get into your physician's office. You don't want to wait. You need some convenience. You want to have a better experience than a 6-hour wait in an emergency room at a better cost so that you can use your healthcare dollars more effectively, more efficiently.
Speaking of that, what are the average waits in emergency rooms these days?
The average wait in the Atlanta area is approximately 6 hours.
Holy cow, still. Okay, because I see urgent care clinics popping up, so I thought maybe that's already had a positive effect on the wait times in emergency rooms, but not quite yet.
Not quite yet.
Okay.
Some ERs are putting in urgent care centers as part of their fast track type setting for less emergent conditions. But still there's a place for urgent care.
So let's talk about that because I have interviewed Dr. Resnick a while ago talking about urgent care centers and how cost effective they are. With the emergency rooms kind of getting into the game with their own urgent care clinics too, are they also as cost effective as the other type urgent care clinics?
Not at all.
Okay.
If you use the urgent care part of the emergency room, you're still being charged emergency room fees.
Okay, that's important for our public to know. So I'm so glad that you're here today because you would assume, because it's the same kind of name and they're doing that in addition to emergency rooms, that you could go there for the same price. So folks, please listen in. This is why we have Dr. Short on the show today and why we bring Better Living to you every week to inform and educate you about all aspects of senior living, and this would apply to anyone. And I wouldn't have known, hey, if I go to an urgent care clinic that's attached to a hospital, I'm going to end up paying more money than if I go to the urgent care clinic that just showed up down the street. Okay, good information. So, we're in the season of cold and flu.
Yes.
And lots of stuff is going around. I know folks with sore throats and upper respiratory and whooping cough or pertussis and ear infections and blah, 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 blah. So how is it that you treat folks versus going to the ER?
Well, in the ER, you're going to wait for an extended period of time. In urgent care, Our goal is to address 1 or 2 concerns at a time and get you out as soon as possible. Our goal at Well Street is to get you in and out in under 45 minutes.
Wow. From the time you step in, or
Yes.
from the time they see the doctor?
From the time they step into the office.
Okay. And what percentage of the time are you able to do that at Well Street?
It varies. Most days we actually do pretty good.
Okay. So that being said, then, are you performing the same tests, enough tests to get to the bottom of it? How do you do that?
We have to be
Yeah.
smart with how we use our healthcare dollars. So we have a lot of rapid testing, rapid strep, rapid flu, rapid pregnancy tests, urines, blood chemistries that we can do that provide us with a massive amount of information with which we can make an intelligent decision.
And you have everything right there at the site. So if you need an x-ray, it's right there. If you need a lab, it's right there. You're not sent somewhere else.
Correct.
Which would be a good reason to maybe go there versus a doctor's visit that you might have to wait 4 hours to get the appointment. And then if you need something, you got to get something somewhere else.
Exactly. So we strive to provide all those services in a one-stop shop, convenient hours, 9 a.m. to 9 p.m., 7 days a week, 365 days a year, which is sort of different from other urgent care centers, which have some limited hours and restrictions on holiday coverage. So I would suggest that everyone know where their closest urgent care is, and know those hours so they know when they can count on seeking out that type of care.
Okay, I have so many questions, but I do want to just kind of revert back to what I just said, because you probably want to see your primary care physician if you can. But if you
Absolutely.
have acute symptoms, I know I've had respiratory issues with an infection that I had and had a hard time breathing. If you can't get in to see your doctor, then you can hit the urgent care center, or you would suggest going to your doctor's office.
If you can get in to see your doctor and maintain that relationship with a primary care doctor, absolutely. That is the best way for you to access health care.
Okay.
Urgent care is the next best way, and the emergency room is the
Third.
least best way because it's the most expensive. It's the absolute most expensive way that we access health care in America today.
And if you're waiting 6 hours with all of those other sick people, if you don't have something, chances are you're going to get it before you leave. So
Correct.
in and out in 45 minutes is attractive to me.
Correct.
But on the primary care physician side, I want to educate the public that this is not a replacement of the primary care physician, so you should try to get there. However, if you do go to the urgent care clinic and you are treated and your symptoms are no longer exacerbated or making it very hard for you to breathe, per se, let's say, you work in conjunction with the primary care physicians as well. Correct?
Absolutely. In fact, we are a strong referral source for many primary care doctors who are on vacation, after hours, weekends. That way, they don't have to give the answer of just go to the emergency room. We can go to an urgent care center, and then we can forward that information to them so that we have excellent continuity of care so that all the providers know what's going on.
Now, do you all at Well Street automatically give that documentation to the physicians, or do you give it to the patient and the patient needs to bring it to their primary care physician? Because that's a key piece in making sure that there is a coordination of care.
If the patient asks us to send it to their primary care doctor, we will do that.
Okay.
Some physicians, I just sort of really don't have time for that, honestly.
Okay.
And some physicians really, really want to have all of that data available to them.
But if you're the patient bringing it to the physician's office, they're probably going to pay a bit more attention to it as well.
Correct. But if the provider or the patient wants us to send that information to their primary care doctor, by all means, that's a high recommendation.
Okay. So now I also want to go back to the important statement you made about making sure you know what the urgent care hours are. What are typical hours of an urgent care clinic?
Most of them are open extended hours, and some open early in the morning, some stay open later. The typical urgent care is going to be open 10 to 12 hours per day, 8 a.m. to 8 p.m., 9 a.m. to 9 p.m. Some have limited hours on the weekends. Some have regular hours on the weekends. What we call regular hours are 9 to 9 for us.
Wow. Okay. And that's important because that's when you can't get a hold of any physicians.
Right.
And I remember you bringing me back to my kids playing football. And, the practices are 6:30 to 8:30. And it was always right before the end of practice that the ankle or the knee or the shoulder or the hand got hurt. And I was rushing to try to get to an urgent care center for the kids. So it is important to make sure you know what those hours are, to be open till 9 o'clock. When is Wells Street open?
9 to 9.
Yeah, that's wonderful. Because a lot of times, you're getting home from work 6:37, you're assessing, you're waiting an hour to see how everything is going, and you're going to be between that, I think, 8 o'clock, 9 o'clock time frame. Do you get slammed between 8 and 9?
About 6:30 or 7, there's usually a big rush.
Okay.
People getting home from work, realize they picked up their kids from the daycare, and, they've got a cough or a fever, or they're not eating. The other factor is that our population is so transient that a lot of patients move or here on business and don't have a primary care doctor identified yet.
How is that affected with insurance?
Well, it depends on the insurance carrier. Most insurances do cover urgent care because they want to do everything they possibly can to keep you out of the emergency room.
Well, that's true, and that would be smart. Okay.
It's a good business decision for most insurance companies to provide urgent care services.
Okay. And if you're in from out of town or you just moved here, I know my mother just moved here, doesn't have a doctor yet, and it is cold and flu season. So if you're in here and you're trying to figure out, is there an urgent care center in the area? You don't even know what name to pull up. Is there a special website folks can go to locate an urgent care center near them?
What I would do is I just do a general search for urgent care and put in your zip code, and you're going to get a list of those urgent cares that are close to you. And most of them are going to have plenty of information on there about what services they provide, what their hours are.
And do they usually do bios of who the physician and nurse practitioner or physician's assistant are that are in the clinic?
Most of them do.
Okay.
We are in the process, since we just opened in January, we're still in the process of developing that part of our website.
Okay. And let's talk about Wells Street, because I was very impressed when I heard about Wells Street and some of the differences in the past. So where is Wells Street located throughout Atlanta? I know you're on Ponce, right in the heart of Atlanta, but there's 6 or 7 centers?
As of this weekend, we're opening our 8th office.
Great.
The first one was on Piedmont, just north of Piedmont Hospital. There's one in North Buckhead, Alpharetta, one opening in Johns Creek, Dunwoody this weekend, Austell, Sandy Springs.
Great. Okay. So nothing up in Kennesaw, huh?
Not yet. Not yet.
Let's talk about the differences between the different urgent care clinics. Because is it best to go to the one that's right around the corner, or is it best to do your due diligence and make sure that you go to a certain urgent care clinic, and why is that?
I would definitely do my due diligence. There's plenty of information on the web, lots of reviews, Yelp, etc., that can give you information and patients' feedback on their experiences. All urgent care centers are not equal. For instance, I used to work at an urgent care center a few years ago, and we had an average wait of 2 to 3 hours.
Yeah, and that it's still better than the emergency room.
Yes.
But if Wells Street is saying we can get you in and out within 45 minutes. And what are the top maybe 3 to 5 questions someone should ask if they're calling urgent care centers to make sure it's the right place for them?
One, what are the qualifications of the provider that's there? Can they actually take care of whatever their condition is? Let's say, for instance, you've got a nasty laceration that involves a tendon. Well, probably the emergency room would be a better choice for you. If you've got a bone sticking out of your skin from a compound fracture, then the emergency room is probably a better choice for you.
So what are the typical reasons to go to an urgent care clinic?
Probably the number one reason that we see patients are for reasons that they really don't need to be there, which is a viral infection, for which we really can't do much about. We can treat their symptoms, we can make them more comfortable, we can give them some reassurance, provide them with some education, but at least 80% of people who come in who think they have a sinus infection or a sore throat or a cough, they think they have bronchitis, at least 80% end up being viral, for which antibiotics are of no benefit.
And you know what? That's so frustrating. We need to do something about that. We need to come up with something, because those viral infections can really make you feel horrible. And if you can't function and go to work, you want someone to treat you and make you better. But how do you know if it's viral versus something that an antibiotic would be able to take care of?
It can be hard. It can be hard to know. But let's say, for instance, sinus infections. At least 80% are viral. Bronchial infections, about the same, 80 to 85%. Sore throat. Everybody thinks they have strep throat. At least 90% are viral. So if you're just playing the odds and are aware of what the statistics are, then you can make a pretty good estimation.
So let's talk about that, though. So you're at home, you know you're feeling horrible, and that's going around right now. People have sore throats and sinus aches, at least. I won't call it an infection. And then their ears hurt. How do you know that that's not just swollen glands pushing on your ears or whatever, not an ear infection, and terrible cough is going around? Do you recommend people go to the urgent care clinic or what? How do you know?
If you haven't been able to get symptom relief with some of the over-the-counter products, and if you're getting worse, especially if you're running a high temperature, or if your symptoms are lingering for more than 4 to 5 days, then it would be appropriate for you to seek out an urgent care center if you can't get into your primary care doctor.
Okay. Even if you have a temp for a day or two, just kind of treat it and see, don't rush.
Absolutely. We need to be more careful with how we use our healthcare dollars, and we don't want urgent care to, although it does increase people's access to healthcare, we don't want it to contribute to the healthcare expense burden for the population.
But even outside of expenses, you know, you hear about all the misuse of antibiotics and how that's hurting our bodies and how that's creating a problem with treating super infections down the road.
Correct.
So even more importantly than money, we don't want to just jump to get an antibiotic when we have a viral infection. It's not going to do anything anyway. We're taking it in our bodies and we're creating a future problem.
Unfortunately, what happens is that a lot of doctors will just provide a prescription for an antibiotic, okay? Because it's easier than educating the patient.
And they are doing something, so the patient's not frustrated. So again, folks, okay, I'm going to get on a soapbox for just a minute, because we're talking about, we just had an election, and nobody's going to like any of the decisions that have to be made in our country going forward, because we need to reel it in a little bit, okay? Not to talk politics on a health show, but same with your health care. You know, you've got to be reasonable and take into account, be accountable and be responsible for the bigger picture of healthcare. And what worries me more is the misuse of antibiotics and how that can affect us getting proper treatments in the future that can take care of our infections versus not working because we've misused antibiotics now.
That's correct. Yeah, the resistance rate for a lot of bacteria has skyrocketed in the last 10 to 15 years. That's what we're seeing with MRSA, the resistant form of staph that we're seeing in nursing homes and among sports teams. That's largely the reason why that is so prevalent, is because of the abuse of antibiotics.
So right now it's with groups that are treated with antibiotics frequently, which is why folks in nursing homes or assisted living facilities would be so susceptible. But also the sports teams, I hadn't thought of that. So
anybody that is involved in a cluster is going to be at risk.
Okay. And that's really going to affect our children. So we really have to look at that because their immune systems are not as built up. Not to have a show completely on antibiotics. I didn't know we were going to take this turn, but I feel strongly that's going to affect our children who don't have the strong immune systems to fight the infections. And if we run out of antibiotics to treat them, then that can bring much more severe results in the future.
Absolutely.
Okay, so back to you have a viral infection, you feel terrible, you really want somebody to do something for you. Let's talk about some ways folks can get themselves back on the track to health, whether it be medications over the counter or other ways that they can help their symptoms.
Well, the pharmacies have a aisle after aisle after aisle, thousands and thousands of medications that you can take. Most of those, to be perfectly honest, are just going to give you just a minuscule amount of symptom relief. The average person, if they have a viral infection, let's say, is going to get better in somewhere between 2 to 5 days, no matter what. Unfortunately, if we give you an antibiotic, then you're going to get better in 2 to 5 days. And you're going to attribute that improvement with the antibiotic.
That's true. And, you know, I'm a fan of holistic ways to help your body as well. You know, when we had babies, we'd sit in the steam shower to clear out their noses and their lungs and their junk. And I don't think we do enough of that for ourselves. We just run to medicine. I've been known to put the hot water on in the sink and throw a towel over my head just to get that steam and clear myself out. But I feel like that makes me better a lot faster than any medicine could.
Yeah, that's going to give you not quite immediate, but a pretty rapid response. And that definitely is an option for you before you seek out a healthcare provider.
And so for sore throats, too, is there anything that we can do for sore throats? I mean, I love Halls. I could go and, you know, suck on those Halls for 2 days. But is there any other good nifty tricks that we can share?
You know, Tylenol, ibuprofen, the throat sprays, the throat lozenges, and just, unfortunately, for the most part, it's just a passage of time.
And here's an important one, because I have a thyroid condition, so I have to be very careful about all of those great sinus medications that are on. I just have to suffer through it, period, which is why I stick my head under the sink with steam. But it works. But when you're getting that real pressure headache from the cheekbones, from the teeth up, is there anything that people can do outside of medicine for some relief?
In that case, I would recommend that they use either a neti pot or a saline sinus rinse that are both available over the counter. And those have gained in popularity and effectiveness, significantly in the last few years.
Yeah, and you know, I'm sure there's lots of people out there, I hate spraying stuff up my nose, but they do seem to work.
Yes.
Okay. Well, we have so much more to talk about. Well, we do have to take a quick break, so stay tuned, and we'll be right back with Dr. James Short. Hello, I'm Jean Pete, and I welcome you back to our show, Better Living. Better Living is brought to you by the Homestead Hope Foundation and is sponsored by Homestead Hospice, where commitment to education and premier hospice care helps patients and families through life's most important journey. Welcome back to Better Living. I'm Jean Pete, and again, we are still here with Dr. James Short from Wells Street Urgent Care. Is it centers or clinics?
It's we don't use either term really.
Okay.
But
From Wells Street Urgent Care.
That's it.
Before we'll recap a little bit about what we talked about earlier, and that is all the reasons why folks need to be due diligent about their own care and why you need to know where the nearest urgent care clinic is near you and which urgent care center you want to go to if you have an acute symptom or if you're suffering from upper respiratory infection or what have you. So again, can you let the audience know who you are, who you work for, maybe how they can get in touch with Wells Street?
Okay. Again, I'm Dr. James Short. I'm the site director at one of our offices here in the Atlanta area. My office that I'm the site director of is on Ponce, which is in Virginia Highlands, not too far from downtown Atlanta. We are open 9 a.m. to 9 p.m. We currently have 8 offices as of this weekend, scattered throughout Metro Atlanta. We only have physicians on staff, and all of us are either board certified or board eligible.
And that's important. We didn't talk about that before. I do just want to let folks know, Well Street, you can get information about Well Street Urgent Care if you go to www.wellstreet.com, and you can contact Dr. Short's Center by calling 770-809-3034. Did I get that right, Dr.
That's
Short?
correct.
Okay. But not all urgent care centers are alike. So whether you're in New Orleans, Phoenix, Atlanta, wherever you are, you need to do your due diligence. And something that you just said, Dr. Short, I want to touch upon because we hadn't touched upon it earlier. You need to make sure the clinicians in the center are appropriately certified. Can we talk a little bit more about that?
Sure. Let's, in our centers, we're all board certified or board eligible in internal medicine, pediatrics, emergency medicine. Whereas, let's say, for instance, at some of the urgent care clinics that are in some of the pharmacies, not to mention any names, those are staffed by nurse practitioners for the most part. I'm really amazed at how many patients we get referred from those types of pharmacy clinics, several a day. And they do not provide the level of service that a physician can, but they still provide a much needed service.
Mm-hmm. And it's good that they're referring to you all. So they know, we can do this here, but we can't do this here. And they're referring to the urgent care center, not the ER from where they're at.
For the most part, yes.
Okay, so they're mostly nurse practitioners, and they may not have experience in urgent care. They may not have come from an ER background or a trauma background or what have you. Is that what I'm hearing?
That's very true. Most of them are going to come from a primary care background.
Okay.
And they're going to be able to handle things like strep throat and ear infections, but you don't want to go there to have an STD treated, as an example, or if you've got a pneumonia. Those are the types of things that they refer to us.
Right, and that's what comes to my mind. If I'm having trouble breathing because I'm suffering from whether it's viral or bacterial infection, and I'm wheezing or just can't breathe, I feel like if I go there, they might not have the equipment that I need to take care of me right then and there, or would they?
They have the ability to do some rapid testing, but they don't have any other methods to treat you, like a breathing treatment. As an example.
Okay, so that's good information for our audiences to understand because there are so many choices out there. However, if you really feel yucky and you're going to the pharmacy and you're getting some medicine and they're right there, perhaps you don't need to go to the next step. But if you're at home and you're not feeling good and you're trying to decide where to go, sounds like urgent care center is the better choice.
Of course I'm going to think that's a better option because you're going to get a physician versus a nurse practitioner. Again, not to denigrate nurse practitioners because they do have a valuable role. And I really believe that as the future will reveal that we are going to have a significant shortage of physicians in the next 15 to 20 years, up to 50,000 primary care family practice doctors as an example. So in reality, we're probably going to become more dependent on nurse practitioners and physician assistants to provide a lot of primary care.
It's funny because my nanny is in college and she's going to school to be a nurse, and all those young 20-something folks that I run into that are talking about healthcare, a good future career would be nurse practitioner or physician's assistant for that exact reason. We're going to run out of doctors.
Oh, absolutely. We've got an aging population. We've got an aging group of physicians. About 25% of all physicians are 65 years or older.
1/4 of our physicians?
Yes.
Wow.
And they just can't educate them and train them fast enough.
Well, and not only that, it's not as appealing to become a physician.
No.
You rack up huge education bills, and then you have to pay huge insurance right out of the gate while you're paying those bills, and they're cutting the payment for the physicians that are coming right out of I mean, unless you're a cardiologist doing heart surgery, am I right?
Well, they're still cutting those payments too.
Well, that's
but
true.
if you ask most physicians if they had it to do all over again, would they go into healthcare? About 30 to 35% would say no if they knew now or knew then what they know now.
And that's a tragedy, and that's what we don't see. You know, that we don't understand. We romanticize the whole, they're a doctor. It's a tough world out there right now for physicians.
It's a lot of work. We're having to see a significant increase in the amount of patient volume just to make the same amount of income.
Because our patients are aging as well, because we're in an
patients
aging
are
population
aging
too.
And the payments from insurances have actually not kept up with inflation or with the cost of running an office.
So I've actually read articles on this and how less and less folks are choosing, especially primary care, internal medicine, that kind of care. They're going to very specialized types of medicine to make up for the difference. And so we are in a crisis here, and people may not realize how large that crisis is. But with what you just said, 25% of our physicians 65 and older, that right off the top only leaves 75% of the physicians left. Then if you take half of the folks that we were able to pull from the pool of physicians 20 years ago, we don't have but 50% of that pool to pull from to become physicians, and then they're choosing specialties instead of primary care, internal medicine, which is what we really need until we're much older and in our Medicare days.
That's correct. And the reason they're choosing those specialty fields is because they can make so much more money. There's an underappreciation for the value of primary care doctors and how we really do serve as the first contact and treat the greatest percentage of patients that really don't need to be seen by a specialist.
So that's important to know, that Well Street has physicians that are going to be caring for you if you walk into one of the Well Street centers.
That's correct.
But that may not be the case for all urgent care centers. Is that right?
That is true. Most urgent care centers are going to have a physician. They may have a secondary provider in the office, a nurse practitioner or a PA. They may have another physician if they're busy enough and large enough. But, I'm a physician. My opinions are skewed toward physicians. I would prefer personally to see a physician. But there are some really good nurse practitioners and PAs out there.
Well, and we have to get used to that, because that is going to be the future of our first point of healthcare. I think it's going to be harder and harder to see a physician.
It is. And we're going to have to change our expectations and really accept care from someone who doesn't have the MD credentials.
Okay, so let's talk a little bit about that. And because what can a nurse practitioner or physician's assistant do, and what can they not do that a physician can? How is that going to impact us?
Let's say, for instance, we're talking about one of the nurse practitioners at some of the pharmacy clinics. They are limited by what they can do by a protocol. And they have basically a cookbook that they practice from. And if your symptoms, if their opinion on what your diagnosis may or may not be doesn't fit into the protocol that they've been given, then they are unable to treat you for that condition.
So what do you do?
Well, like, for instance, we get probably at least one, maybe two referrals a day from an urgent care or from a nurse practitioner staffed clinic for possible pneumonia. They may or may not have pneumonia, but they do not have the authority, according to their protocols, to treat a pneumonia. They can treat a bronchitis, but if they really think it's pneumonia, they are required by their credentialing and the protocols that they have to work under to refer that elsewhere.
So what I almost see the future being is the doctor's there as the referral from the nurse practitioner or PA that's taking care of most of the patients. And the doctor's just hanging back for the things that the nurse practitioner can't do.
I think it's going to have to be a coordinated effort in the future between all of the groups, the nurse practitioners, the PAs, the physician assistants, and the MDs or DOs who are the primary care providers.
Kind of scary where we've brought ourselves here. Let's talk a little bit about Affordable Care Act and the increase in Medicaid and how all that's going to impact the future of medicine. Not to get into politics, but we're hearing about this and the financial cliff, so we know there's going to be all kinds of cuts coming additionally in the future. And not to put you on the spot, we can keep it neutral.
Well, my opinion with the Affordable Care Act is that it may not be the best solution, but at least it's a step. I think probably the biggest mistake we could have made is to have done nothing. That's what's gotten us into this situation where we are now. Doing nothing was not an option.
You can only live in denial for so long.
Correct.
Then it's going to hit you in the face.
Correct.
We're getting hit in the face.
Yes. Yes. We've got millions of people who don't have access to health care. As a result, they end up using the emergency room as their primary care doctor. And they usually also end up delay treatment so that when they do show up, they're much, much sicker and require a much higher level of care than they would have if they had had access to affordable health care. The hospitals, as a result of taking care of those uninsured patients, are having to eat that cost. And that's one reason why, if you have insurance, your costs are so exorbitant, because they have to distribute that cost somewhere. So they distribute it to those of us who do have insurance or who have access to financial resources.
And so Affordable Care Act and making sure everyone gets insurance, which is why Medicaid is going to be increasing. More folks are going to be on Medicaid.
Yes, more people are going to be on Medicaid. If I'm not mistaken, it's about 35 to 45 million more Americans will qualify for Medicaid. All the states are not going to participate in the pool that's going to be created. Some states are going to create their own. Some states are going to let the federal government create it for them. But the reality is that we are paying for those people's health care one way or another.
Right, but now we're paying it out of our Medicare dollars, out of our paychecks, right? Out of our government, state, and federal taxes.
If they have Medicare. We're
going to be taxed so that so that everybody can get health care, right?
We also are paying it due to higher insurance premiums.
See, that's where I was going, because I was thinking, okay, well, we're taking the burden off the insurance companies. Wouldn't it be nice if now it cost us less for insurance? But that's not going to happen. No,
it's probably not. But the economics of it is that the more people that are insured, that enables, in an ideal world, would enable those costs to be distributed among a larger population. We'll see if that happens. I don't think that anybody really is expecting that.
Yeah, we're not expecting a benefit. We're just expecting more financial burden. But the good news is the states hopefully will not have to spend so much in the higher cost of health care, and those dollars will hopefully get put somewhere else, like schools.
Oh, that would be nice.
Who knows? Okay, so we've talked about Well Street. We've talked about urgent care, making sure that you're going to the right urgent care. We've talked about season of cold and flu and how you can take care of yourself better, and difference between viral and bacterial. And the bad news is most of the time you're going to go to urgent care anyway, but you probably should just wait it out because it's not really going to make a difference.
Exactly. As much as I would like to drive that volume for the urgent care centers, the reality is that most of the time it's viral.
Okay, and then we've also talked about the aging aging population of our country and the lack of physicians. That being said, are you seeing more older adults coming to your clinics more frequently?
Oh, absolutely. Because if they have a primary care doctor, they may not be able to have access to them in a reasonable amount of time, and they know that their health conditions are a lot more intense, and that they are more fragile than someone who's younger. So they are seeking out services prior to their condition deteriorating.
Thank goodness. Because as we're telling everybody else, wait it out, that might not be the best plan if you're an older adult, if you're elderly, a senior.
For the elderly and for those who have chronic medical conditions, let's say, for instance, somebody with diabetes, someone who has HIV or any kind of other immune dysfunction, those individuals need to have a low threshold for seeking health care.
Get yourself there.
Yes.
Yeah. And that's when it is helpful to see the physician, whether you need it or not. It's peace of mind and making sure you don't get on that downward spiral quick.
Because those people can get really sick really fast. And then, of course, that involves increased expenses and increased morbidity, more pain and suffering.
Well, and let's talk about diabetes because, in my experience, I've worked in home health and hospice for a long time. Whenever diabetes is added to a condition, we get more serious because, like what you just said, they can get downhill very quickly and it can increase morbidity. So we've got to take care of diabetes is running rampant in our country.
It is. In America right now, there's 17 million Americans, or roughly 6.2% of our population that has diabetes. Most of those, at least 90%, are type 2 diabetes. And of those, 80% are related to obesity.
And let's talk very quickly. So there's type 1 and type 2. Type 1 is when you're diagnosed at birth and it's a...
We used to say that, but type 1 really is where your pancreas just doesn't produce insulin. So you're going to be insulin dependent. We don't exactly know all the causes of that, but one of the theories is that is the result of a viral infection that affects your pancreas so that you have to become dependent on insulin. Your body just doesn't make it, period. Type 2 diabetes usually occurs later. It can occur as early as adolescent, but it's where your pancreas still makes insulin, but your body is resistant to it. It doesn't process it correctly. So the medications that we use for diabetes either work to increase the amount of insulin your pancreas makes or to increase the effectiveness of what insulin you do produce.
I see. And the type 2 diabetes is the one that is best managed by healthy eating and exercise. You can actually decrease or, I guess, increase the effectiveness of your body's production of insulin.
You can actually, if you control your weight, lose weight, exercise, watch your diet, limit your alcohol intake, stop smoking.
Oh, what fun is that?
I know. Then diabetes type 2 can actually be managed in many cases without medication.
That's important because of the, what did you say, 6.5 million? No, 17 million, 6.2% of the population that has type 2?
That's all
types
of diabetes.
Types? Okay. So what percentage of that do you think is type 2 diabetes due to our society's lack of exercise and healthy eating?
Well, if you take all the type 2 diabetics, which is 90% of all the diabetics, 80% of those are simply related to obesity.
I see.
And obesity, of course, has a lot to do with our diet, our lack of activity, our sedentary lifestyle, our alcohol intake.
It's in our control.
It is.
So, folks, if you have type 2 diabetes, and I know we're here talking about urgent care and cold and flu, but, this is important because you have children, you have grandchildren, and easy for me to say because who likes to eat a vegetable without being slathered in butter and loaded with salt, but you can get a steamed vegetable without salt and butter, and it can taste good. You throw some pepper on there. If we just do little things to improve our diet, we can be here for our children and our grandchildren for many, many, many more years.
In regard to diet, we're talking about proper choices, more vegetables, less sugar, and the right size portions. If you remember when you were a child, I think about the size of plates that we had when I was growing up. They were small. And now you go to a restaurant and 4 plates will barely fit on an average size restaurant table. They're huge.
That's so
and
true.
They're full.
That's so true. We've done it to ourselves, and it's so hard. Although I do see more and more people getting healthier. I think people are getting smarter and are trying. You know, we're at a disadvantage because so much of the food that's given to us here in the United States is treated with all kinds of hormones and antibiotics and this, that, and the other thing. So we're already at a disadvantage. But then on top of that, everything's supersized. So now when you see a little bit on your plate, you think you're going to be hungry when you're done eating. So psychologically, before you even start to eat, you don't think it's enough. But diabetes is such an epidemic in the United States today, and we have got to educate people. And we only have a couple minutes, so I'm going to stop right here because I want you to talk to the audience today about some of the symptoms that may indicate someone has onset of diabetes so that they can go and get treated quickly.
Okay. Some of the symptoms, they're really kind of nonspecific, but there are well-documented symptoms that are out there. Fatigue, unexplained weight loss, increased thirst, increased urination, increased desire to eat, poor wound healing, blurry vision. Those
and
are
they'd
the most
have
common.
increased weight loss?
They have increased weight loss because they don't have the insulin to properly metabolize the calories.
Okay.
So they end up losing weight.
Even though they're more hungry and eating more?
Yes.
I see. I think the key ones there are you're constantly thirsty.
Yes.
Yeah, if that's happening with you, please seek treatment, because if you're going to be diagnosed with type 2 diabetes, best to catch it as early as possible and adjust your diet and get out there and walk so that it doesn't become a problem where you end up losing limbs and becoming blind, and it's a very serious illness that's in your control. So prior to us ending the show today, and there's never enough time, I'm so grateful that we went on that diabetes path today, because it is so important for our country. Dr. Short, thank you so much for joining us. We'll have to have you back.
Thank you very much.
Lots to talk about to keep people healthy and living better. I'm Jeannie Pete. Thanks for listening. Have a blessed day and week ahead, and listen here same time next week and every week. Homestead Hope Foundation is your resource for a healthy life. God bless.